So it's exciting that we have a start in progressive disease, but as you say, we need to do better. So what do you see coming along for progressive disease?
Well, separate from immunomodulation and B-cell depletion, I think there's some new data suggesting that B-cell depleting drugs not only deplete B cells, but there is also depletion of T cells that express CD20. And CD20 positive T cells may be involved in progressive disease because they are pro-inflammatory, they do correlate with disease progression, and there has been a recent paper or two showing that ocrelizumab not only depletes B cells, but it depletes these CD20 positive T cells. I think that would help explain a number of things in the context of this form of treatment, including progressive disease. So it really raises the question, could those CD20 positive T cells involved in progressive disease? The other thing, of course, is neuroprotective drugs, channel blockers, although we have not seen remarkable results with those yet. Energy repleting drug, including biotin, is another thing that's being looked at. And that would be interesting to see if the original study that showed some marginal effect would be replicated in the larger population of patients. And finally, I think, and in addition to that, I would like to add that prostaglandin inhibitors may be promising in terms of treating progressive disease. There are studies going on with at least one drug in that context. And diet, I think, and vitamin D potentially could be important in slowing progression.
Other thoughts?
Well, Ibutylast had a positive phase 2 trial, a phosphodiesterase inhibitor, so we'll see if that, is pushed further.
Alpha-lipoic acid has also been shown in brain atrophy studies, maybe another option.
Another small study, yeah. Statins, yeah. And that's so Ibutylast, I don't think there's a follow-on study yet. Statins there are. So Jeremy Chataway has another statin study that's, I think, fully enrolled now. High-dose biotin will have data around this time next year. I thought it was going to be earlier, but it's not. It's going to be into 2020. Trying to think of what else is out there.
I think
Masitinib is being looked at.
Which?
Masitinib.
What's that?
It's an anti-mast cell agent, oral agent.
Okay, yeah. So that gets into this issue which folks at your center have talked about a lot is do we need to start looking at more innate molecules? Something working within the central nervous system, which you had stressed. Because I think that would make a lot of sense in dealing with progressive disease. If the inflammation, however much is there, and the pathologists say inflammation is there through the entire course of the illness, if it shifts to being more localized and compartmentalized within the central nervous system.
I think one of the things we are left challenged by is the fact that we use and rely on MRI as much as we do, particularly in the progressive phase of the disease where you do not see significant changes with inflammation or new lesions on T2 or flare. And there's probably some low-level inflammation happening that we're not able to visualize easily on the imaging. So when we come up with a better biomarker for that phase, we might be able to come up with better treatments.